Okay, that's fine.
Okay.
Yep.
Thank you. There's the mic on the podium works. If with the handheld mic, I can do that too.
Okay.
Which works best for you?
It doesn't matter. This one is the handheld?
No, the handheld is in the middle. That's the podium mic is there. Do you want the handheld? Walk around a little bit.
Yeah.
Okay, I'll grab it for you. Test.
All right. All right, are we ready to go? All right, how we doing? All right. I thought you just had lunch, isn't it?
Yeah, we have lunch at number 1.
Wow. Some of you sound so hungry, or was the food really good, you're falling asleep? Or you didn't, the food was not so good, you're hungry. Which is which? Right? My name is Alieu Nyassi. I'm going to talk to you today about healthcare disparities. We all know that this is the only country in the world where many people travel from around the world to receive care. But if you look around in our neighborhoods, people that grew up, born and raised in this country, still have challenges in how they access healthcare. And that is because many times your skin color determines what kind of care you receive, income, employment, where you live, your zip code, the language you speak. All those are what we call social determinants of health. They determine what kind of care you receive. Today, you will see me that I have this on, right? I put on this because I'm honoring a person that when his first movie came out, when Black Panther first came out in 2018, my son, who is now 11 years old, made me go to the movies, made me go to the theater 5 times. Right? And then we'll go to the movies and he will say to me, Dad, can we just go back and watch it again? I'm like, no, it's not going to be another 3 hours in the movie. We don't live here. Right? That is the only superhero that looked like him. When the movie came out on DVD, we bought it. When it came on Netflix, we watched it. Right? When I went to Africa, in my little village, there's no movie theater. I went with my laptop. I took the DVD. Kids, my nephews, my nieces, neighbors, they all came in like this into that little laptop just to watch Chadwick Boseman. He was 39 when he was diagnosed with colon cancer. He died at 43. And colon cancer is the only disease, the only cancer, or one of the few cancers that is preventable 99%. You get your colonoscopy, you get the screening. If they see a palate, they remove it, you're good to go. It is the only cancer, one of the few cancers, that affects every race, ethnicity, whoever you think about at the same rate. But people of color, mostly African Americans and Latinos, die twice as much than their white counterparts. The question is why? I'll tell you a story about myself related to colon cancer screening. I had a doctor. This was 7 years ago. This doctor was one of the best doctors I would say I've ever heard. He's white. He was great. This is in Pittsburgh. So don't hold me tight because I'm in Bengals territory. Yeah. But this doctor was great. I do my annual physicals every year. And he did everything. And this time around, I'm going to tell you my age. This is 7 years ago. I was 45. And I said to him, Doc, you asked and you did everything that you need to do, but I'm 45. I'm in healthcare. I'm one of those that are working to bridge the gap, to close the gap for the healthcare inequalities. You never asked me if I'm interested or if I'm a candidate for colon cancer screening. What he said to me was mind-blowing. And he said, in our industry, we think this is not an okay conversation with African American males. And I said, but I'm African American, so who is wrong? And I did my first colonoscopy. Fast forward, I did it again 5 years ago. Actually, 4 years ago. I'm now doing my second one. My next one is due next year, 2023. Right? When I did it 4 years ago, they found a pallet and removed it. I'm okay. What would have happened if I was not that proactive to do this? How many black men are going to die? How many black women are going to die until the system, our structures, our policy makers make it mandatory for every doctor, every healthcare system to say it is a requirement? Because this is the disease that's taking a lot of young people. Look at Chadwick Boseman. We wanted him to be in Black Panther 2. We couldn't. He's the first black superhero whose life was cut short. How many are we going to sit by and watch die from diseases that is preventable? Think about breast cancer. The likelihood of women of color that are breast cancer survivors to go into bankruptcy or to go into real poverty after they survive is higher than their white female counterparts. There was a report that came out of Philly that said women of color were screened at a higher rate than their white counterparts. But they also die at a higher. So why is it that you're getting more women screened, but the more they get screened, the more they die? Now I know I have breast cancer. What else? Is it access to even getting treated? Or did they say, oh, you have breast cancer, now your insurance says, no, President Obama talked about how his mother, he had to be an advocate for his mother, for insurance to cover. And he ended up becoming the president, right? And his mother was white. What happens if your mother was black? So it's our job, it's our responsibility. And how we can address this, I have my colleagues from St. Elizabeth over there. And they came here today, and I have to tell you, until about a couple of weeks ago, I moved out of St. Elizabeth and doing my own thing. Started my own LLC, continuing this diversity, inclusion, equity work. But they're here today just to make sure people know about opportunities, right? it should be our responsibility to make sure we go into the communities of color, try to recruit from those communities. That way, when people come into your organization, your hospital, for care or for your services, you have people that are culturally competent to ensure that these individuals that come find a safe space and find people that are culturally competent, that know who they are, and could help them with what they have to deal with. So one, we have to make sure that we have the manpower that is diverse. We have to make sure, because many times we all talk about equity, but we talk about access, right? Many times we talk about access, but we are not committed to equity. We can have access to people can come in, but if people are not able to receive equitable services, then we are wasting our time with access. I have come into places where I'm with my doctor, and this happened to me not once, not twice, over the time that I've been in the United States. Sometimes I bring my child to the doctor's office, or sometimes it is me. When they sense an accent, they start speaking louder. Their voice started going up, like, I'm not deaf. I just have an accent. And I could even teach you how to write in English. But because I have an accent, you think, oh, let me speak louder, because people with accents maybe don't understand when you speak slow. It's not this. Right? I'm not deaf. I'm not hearing impaired. And I didn't tell you that I have limited English capability. So why are you talking to me loud? So being culturally competent is very important. But being able to treat people equitably. Either you are in healthcare or you are working for a human service agency, and you know that what you do, make sure when a client comes into your community, your space, even when they start thinking about you, about your organization, your structure, the experience starts there. When they enter your space, to the minute they leave your space, it matters. I work for this healthcare system. And 2 weeks into my job, we were hit by not being able to get reimbursements up to about $250,000. CMS was not going to give us that money. And everybody in the room started complaining about, hey, this is why I don't like Obamacare. I'm like, wait a minute. What's going on? They said, they're not reimbursing us $250,000 because of repeat admissions. Repeat admissions means a patient came in and came back within 30 days for the same issue. When that happens, CMS sometimes don't reimburse you. And everyone was angry. I said, hey, let's talk about why are they not reimbursing us? So we looked at our patient demographics. 75% of our patients are white. 25% people of color. I said, great. Let's look at those repeat admissions. What percentage? Well, let's look at the demographics of those individuals. We came to realize that the numbers flip. 75% of people that are coming back for the same case come from the 25%. I said, good, let's look at another step. What was the entry point? Did they come here referred by a doctor? Or were they here through the emergency room? Or through an urgent care center? 80% came through the emergency room. I said, okay, let's look at our discharge instructions. We were only discharging everybody with English language, in English language. So that's going to be music. I love reggae. So if you like jazz or you like country, and reggae is just like music, right? It's a song. So you will not understand. You get a paper that says, all right, great. Follow up with your doctor in English. I cannot read English. How am I going to follow up? And for others, we said, for African Americans, we still tell them, follow up with your doctor. How many of those individuals have a doctor to follow up with? So every step that we took, there's a learning. And at the end of the day, we realize we're sending people out and say, follow up with your doctor. They don't have a doctor. So they sit at home, and in the case they have the same symptoms, where do they come back? To the emergency room, and we admit them. The person that doesn't speak English, what happens? You give me a paper I cannot read, I go home, the same situation happens, I come back. And are we even calling them to find out? So we took steps to make sure that anytime we discharge a patient, we're trying to find out if this patient actually has a doctor that we want them to follow up with. If they don't, we schedule it. We call our physicians and say which one is open. And if they don't have transportation, we provide Uber or Lyft to get them to that follow-up, 3-day, 4-day, 5-day follow-up. Within 30 days, we see our numbers come down. Our CEO called me, and we were there with our chief medical officer, and he said, how did you know this? I looked at our CEO and I said, hey, would you allow me to do any surgeries in the theater? He said, no. I said, good. This population that we are serving, I'm also the doctor in that area. We have to understand people. We have to be culturally competent, which means we have to be self-aware. In self-awareness, when we know who I am, and I know Jordan, I'm Muslim, Jordan probably is Christian, or whatever, Baptist, whatever, Catholic. Now I know that we come from two different religions, even though we are both African Americans. I'm aware of who I am, I know what she is. So I move into cultural knowledge. Now I know who I am, I know who Jordan is. I'm going to move to the next step, that is sensitivity. Because I know myself, I know my awareness, I know my biases. I know who Jordan is. Now it is time for me to become sensitive to Jordan's need and how I treat Jordan. Maya Angelou said, people will forget what you said, they'll forget what you did, but they will never forget how you make them feel. It is going to be our responsibility to make sure that the feeling that we left with people is the feeling that we want them to experience. And we don't do what I call 7-Eleven. That is, you see a person, and before you could even talk to them, you have already taken 7 seconds to make 11 assumptions about this person. Assumptions become judgment, and when you judge, it is difficult for you to get out of that. Because you already know, Alieu is telling you, hey, this is who I am. No, he's from Africa. His English is probably this. And people ask me, when did you learn to speak English? I'm like, yesterday. You have an accent, where are you from? I'm from the Upper Peninsula in Michigan. I lived in Michigan all these years, right? But this is the thing. When we make those assumptions, they become judgment. And then our ability to be sensitive to this person is impacted. And then when we are sensitive to the person, we want to treat them with dignity and respect, we move to that cultural competency stage where we model our behaviors so that we can treat this person with dignity and respect. When we start treating people with dignity and respect, we are aware of their needs, we will definitely be able to address health and healthcare disparities. I want to thank you all very much. This could be an hour, 2-hour talk, but I have only 10 minutes and I have not used 15 minutes already. But I want to thank you all very much, and I hope that we will take these steps to make sure that we serve every individual we come into contact with equitably We have to understand about their feelings. We have to be sensitive to the fact that the playing field is not leveled. And sometimes we have to do more to make sure that a person gets what they need. Don't tell me to take 2 tablets or come into chemotherapy when I didn't show up, you become angry. The first thing you didn't know is, do I even have the ability to come to chemo? Am I depending on somebody else to transport me? Did that person have a job? If they left that job to bring me, would they get fired? And when they get fired from their job, would I have a place to sleep? These are all layers come together. That tells people, and that shows all the time why patients are not compliant with what doctors are telling them, and the doctors and the providers are angry, say they don't want to come. They want to come. Nobody wants to be in pain, but sometimes they cannot come because of some of the circumstances that they face. We have to take the time to do that. Thank you all very much.